Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Welcome to Dr. Jeff Talks About Sex and Intimacy. This podcast is dedicated to helping you build healthier relationships, deepen intimacy, and enhance sexual well-being through compassionate conversations that are grounded in science, clinical expertise, and real-life experiences. Every week, we explore the many dimensions of intimacy, from communication and desire to sexual health, emotional connection, and everything in between. My hope is that each episode leaves you feeling more informed, more hopeful, and more connected to yourself and to those you love. So I'm your host, Dr. Jeff Albaugh. This is episode 80, Afterglow, How Intimacy Fuels Relationship Goodwill. I'm really excited about this topic. Whether you're joining us live or listening later, I just want to tell you, thank you so much for being here. We're across so many platforms. We're on Facebook, we're on YouTube, we're on X, we're on LinkedIn. A quick favor, if you are a Facebook person, follow us. The more people that follow us, the more we can do on Facebook, and we appreciate all our followers. So thank you. Visit the website. You can learn about upcoming episodes on the calendar. We have amazing things programmed through October, and you can go back and watch all the episodes that we have in there with all of our awesome expert guests. So please go to the website. Lots of good stuff there. You can take us with you. We are streaming with you. We are on iHeartRadio. We're on Spotify. We're on Amazon Music. So when you're working out, work out with Dr. Jeff. When you are on your road trip, take your loved one and cuddle up. And as you're driving along, learn more about sex and intimacy. We can go where you go. We're everywhere you are. As always, I just want to remind you that all are welcome here. Everybody. Whatever your sexual orientation, gender identity, or relationship style, this is a space and a place that was created for you. The mission of the podcast is really easy. I always remind you we are just here to empower and enlighten you with evidence-based information that improves your sexual health, that deepens your loving relationships so you can live your one miraculous, wholehearted life with more love. Who doesn't want more of that? So have you ever noticed, after sharing a deeply intimate moment with your partner, the love of your life, the two of you seem more patient, you seem more affectionate and emotionally connected, not just in that moment, but for hours, even days afterwards? Well, science suggests that's not just your imagination. You're not crazy. Researchers call it afterglow effect, the lasting emotional and relational benefits that can follow a satisfying sexual experience. Far beyond physical pleasure, intimacy has the power to strengthen emotional bonds, increase positive feelings towards one another, reduce conflict, and create a foundation of trust and goodwill that carries into everyday life. Wow, that's pretty amazing what the research has shown. Today, I'm so honored to welcome back one of the world's leading experts in female sexual medicine, Dr. Susan Kellogg-Spadt, and together we're going to explore what the research tells us about afterglow effect, why it matters for long-term relationships, and how couples can intentionally cultivate moments of connection that continue to nourish their relationship long after the moment itself has passed. I'm so glad that you are here and joining us. And Dr. Kellogg-Spadt is an internationally recognized clinical clinician. She's an educator. She's a researcher. She's an advocate in the field of female sexual medicine. She serves as director of female sexual medicine at the Pelvic Medicine Center and is associate director of fellowship program in sexual medicine at University of Pennsylvania. You've seen her on the show before. She is amazing. She is the go-to person. She's a dear friend. She is an amazing colleague. She is my person when it comes to female sexual dysfunction. She is everything. So I'm so glad you're here to join me today, Susan, for this amazing discussion.
One of my favorite topics today is Afterglow, and I'm just thrilled to be here. So thanks for inviting me, Jeff. And thanks everybody for being here with us.
Totally. Well, let's jump right in. So let's get into our discussion. I kind of like that background. I thought that fit Afterglow, huh?
Yeah, absolutely.
And so I was looking at things and I thought, this is kind of cool. And so we're really looking at how intimacy fuels relationships and goodwill. So what the heck is sexual afterglow? Well, it refers to the lingering increase in sexual satisfaction, in emotional closeness, and positive feeling towards one's partner that persists after a satisfying sexual experience. So if you've never heard of it, that's what it is. Well, the research shows it doesn't just last a couple minutes. It lasts quite a little while, which is pretty amazing. When you first heard that, I mean, they say up to 48 hours or so. Was that surprising to you?
You know, it finally explained an experience that I personally have had, but also my patients report all the time. How come is it, Dr. Kellogg, that after I'm intimate with my partner, he or she is like, seems nicer to me? It's really weird. They just are so complimentary of how I look. And they're like, oh, let me bring you coffee, or let's go to dinner tonight, or like something like that. You know, and they're like, how can that be? Well, the truth is, as you suggested, Jeff, it's not your imagination or their imagination. It is a chemical experience that happens when two people or more come together in a satisfying sexual way. Oftentimes that does involve an orgasm or climax. And oftentimes it is this like cool explosion, like the 4th of July in your brain. What comes out in that 4th of July is not just red, blue, and green, but things like oxytocin. These are chemicals. Oxytocin, dopamine, prolactin, and endorphins, the feel-good hormones. So like it's real. And those things run around your body for about 2 days and you just feel pretty good. You feel relaxed. You might find that if you're hurting, you're not hurting right now. You have some pain relief. You might have this like yummy feeling of attachment for your partner, that kind of just fell in love feeling. And it can last, to your point, 48 hours. And I've got some secrets on how to make it last even longer. We'll do that later. You go. What do you think?
I totally agree. And you jumped into this exactly. It's multiple systems. It's biologic, it's psychological, and those two things work synergistically. So you talked about these amazing neurotransmitters, oxytocin, but then we have dopamine as well, which is another neurotransmitter, and then endorphins are released. This is when we are when we have something very satisfying or something that really brings us to another level. Those endorphins pop in. Vasopressin, reduced cortisol, so many things that you talked about are right here, and affection and eye contact. All these things mixed together synergistically to make you want to be even more bonded. And so what do we have? So
let's break it down. Let's look at each of the chemicals, because I think it's so fun to look at each one. So you start with one, I'll do another one, and whatever you want to do. So let's just start with oxytocin, for instance.
All right, go for it. Now I'll talk a little bit about dopamine.
Oxytocin's nickname is the cuddle hormone, and it's a hormone that is released with cuddling and sexual satisfaction. But anybody who's out there being a mom right about now, or was a mom, if you remember that feeling you had, that feeling of deep satisfaction when you were nursing a baby, that's because oxytocin was also released then. Oxytocin makes you feel very, very, very attached. And again, to anybody out there that's a mom, if you were nursing a baby, you felt incredible attachment to that baby because your brain was flooded with oxytocin. When you're with your partner and you're being intimate, And particularly if you climax during that experience, whether it's with that partner or maybe with a vibrator or something like that, you feel just a burst of attachment and like, oh, honey, I love you. I'm so glad I'm with you. And that, I call it a yummy feeling. Oxytocin's awesome. And now we know that in sexual medicine, that's what Jeff and I practice. There's oxytocin lozenges and oxytocin nasal spray that is prescription, of course, but it actually can help to exaggerate that feeling during sexual play if you're kind of feeling like you've lost that love and feeling. But oxytocin's a beautiful thing. It doesn't have a lot of side effects. It's naturally produced in the brain during particularly satisfying experiences. And don't forget, it's called the cuddle hormone.
I know. I love that. The cuddle hormone. It's so good. And then dopamine is your reward chemical. It's responsible for intense euphoria, motivation, and excitement. So it fuels that early limerence or that honeymoon phase of a relationship, making ordinary interactions feel extraordinary and keeping your focus entirely locked on your new partner. Remember how you couldn't think of anything but your new partner? Well, dopamine helps with all that. So, I don't know about you, but both these things, the cuddle hormone and dopamine, give me more of them.
Oh, absolutely. No question. It also, dopamine is really cool because it gets released also in the beginning of a relationship or also during any kind of brand new, strange and how shall I say this, fearful experience, but not true like, you're about to be stabbed by someone. But like, let's say you're getting on a roller coaster and it's a safe roller coaster, but every single time they lock you in and you hear the wheels turning, it's like, oh my goodness, that's a dopamine rush. How about when you're watching a scary movie and they're just actors, but it's just about to get to the scary part? That's a dopamine rush. It's that feeling of excitement and just to Jeff's point, you're locked in. Your attention is solid. Those things are naturally produced when one is being intimate. So what a gift that we have the ability to kind of call up a little dopamine whenever we're ready. Also, back to sexual medicine for a minute, at least, there are ways to increase dopamine. Everybody smile right now. Give me a big smile. Okay, you actually release dopamine when you smile, but also if you want to talk to Dr. Jeff or talk to Dr. Susan, there are medications that can increase dopamine in your brain as well. So it's kind of more fun to do it naturally, but if you need a little help in that department, that's what sexual medicine is about. Jeff, up to you again.
Yes, and so what about endorphins? Those are pretty exciting too. They're natural neurotransmitters in your body. They have a natural painkiller way about them, and they also elevate mood. They reduce stress. They promote feelings of comfort and safety. And remember, we talk a lot in sexual health about safety, that is an absolute prerequisite to love and to intimacy and to relationship and sex. So lots of good things come along with endorphins. We love when we release those endorphins.
Absolutely. Pain relief, physical relaxation, it's awesome. So another thing that explodes in your brain when you're physically intimate, again, particularly if you have a climax, is something called prolactin. Now, prolactin might sound familiar to you because prolactin levels rise when a woman is nursing a baby because that's what helps produce the milk. But one of the other things that women who are nursing babies very often comment on is the feeling of intense relaxation and feeling very at peace, for lack of better terminology, at peace when they're nursing a baby, when their prolactin levels are high. They feel relaxed, at peace, very similar to after a sexual experience. You just feel so relaxed. You feel so at peace, so content. And that's largely responsible because of this burst of prolactin. And even though biological women are the people who nurse a baby, prolactin is present in all genders. And so men can actually benefit from that burst of prolactin that happens with orgasm. Jeff, you're up. There's another name for prolactin in the male body, and it's called
vasopressin.
Vasopressin, yep.
It's a neuropeptide hormone that regulates social attachment, long-term pair bonding, and protective aggression, particularly in men. Working alongside things like the oxytocin, it activates your brain reward center and it fosters feelings of you definitely want this in your relationship: loyalty,
Mm-hmm.
trust,
Mm-hmm.
and then desire to commit to a partner, really. So pretty amazing, again, what these neuropeptide hormones, what they do in our body. It's pretty cool.
I know it's so cool that it's available, without medication for most people, just if they can commit to being intimate. You get a lot of reward from a very little amount of time, to be honest.
Which is
Um,
pretty cool. And what's so amazing is these are the biological things that are happening in your body to create all these psychological effects. And then on top of it, it reduces cortisol, which is your stress hormone, kind of relaxes you a little bit, right? And that can be really helpful too. And then in the end, this leads to we already feel emotional vulnerable in any sexual situation. And so comfort levels with that. We feel more safe with those things. Eye contact increases things like dopamine and increases other things too. And then affectionate touch. So it's like it goes round and round. The more we engage, the more we become connected, the more psychologically these transmitters are released during these processes. And it's a very synergistic, wonderful effect that happens in your body.
Absolutely. I see a lot of people in my clinical practice that are, for whatever reason, unable to have kind of standard intercourse. Penis doesn't go into vagina. It's too painful. It's too dry. Or from a men's perspective, perhaps he doesn't achieve an erection that is rigid enough to create penetration. We're not talking about intercourse here. We are talking about intercourse, of course, but we're talking about any kind of sexual exchange where intimacy is exchanged between two partners. So please know that no matter what space you're in from an intimacy perspective, we're not just talking about intercourse. We're talking about sexual exchange, being together in a loving and intimate way and feeling the burst of these wonderful neurochemicals.
Yeah. And so remember, it's not just physical. One intimate experience can influence a partner for days, as we talked about. So you can have that affection, you can have who doesn't need more patience, greater emotional generosity, increased feelings of security, stronger relationship. All these are the lasting effects of Afterglow, which is really pretty cool. And so all these things are working synergistically to give you good stuff, really cool stuff that's going on with Afterglow. So what matters with it? So you might think, well, then we need to have sex all the time. But quality, right? Quality is more important than quantity when it comes to Afterglow. So you talked about things like the orgasm, remember, it's the satisfying sexual experience, the satiating, satisfying sexual experience. So quality is super important. And then the time after sex can be just as important as the sex itself. That's where the afterglow comes in, the cuddling, all the amazing things. Don't you love those moments after when you just feel so bonded and connected and, laying together? It's a wonderful thing.
Yeah, it is. It is. And that's to my point. One of the things that the research suggests is if after sexual encounter, if you just kind of roll over and go to sleep, you're missing the juiciest part. And that's the pillow talk and just the stroking, not even talking sometimes, just stroking each other's arms or stroking it back and saying, babe, looking at each other, direct eye gazing, really important. Just kind of feeling that the after stuff, I guess, like extending the high for a longer period of time.
Remaining intertwined, right?
Mhm.
Think of what it's like sometimes afterwards, you have this wonderful satiation feeling and your bodies are just intertwined, and it's a beautiful thing.
Absolutely. But again, some people hop up, they're in the shower, they're late for work. I mean, that happens after a quickie, granted, often, but try to make time just to kind of bask afterwards if you can, because you'll get the full 2-day plus effect if you extend it with physical touch and sometimes kind words, but sometimes no words are necessary. afterwards. So really important.
And when you look at happiness research, savoring is a huge thing. And the afterglow is savoring. It's savoring. Before, when you're getting excited and you can't wait, that's called savoring. It's part of what makes people happy. So it's such a big deal. And then Gottman Institute says too, we're always trying to increase that positive bids and emotional bank. And so intimacy becomes an emotional savings account for positivity in the relationship. That's all based on Gottman's research with thousands of couples over 30 years, watching them and seeing, building up positivity with really good quality sexual experiences, with really enjoying that afterglow and connection and relationship, and turning towards rather than away when you want to run, jump in the shower, or whatever you may want to do. But and sometimes that's okay too. But afterglow is a beautiful thing.
Yep. Absolutely. So let's talk a little bit about people, for whatever reason, who can't be physically intimate, that they maybe they just had surgery, or maybe they're separated. Maybe they're not well, maybe they're separated, but separated physically. Maybe he's working in Dallas and she's working in New York. What are some things that could happen that would kind of mimic this a little bit? So let's talk about for a minute things like date night. Research suggests that for women, date night about every 2 weeks should happen to help to keep those neurohormones going. So could you have a date night just on the phone? Jeff, what do you think?
Absolutely. And I do have couples who are long distance. They're not always together, and they have some wonderful intimate sexual experiences over the phone. So I think all of that is great. And then now we have FaceTime. So you could also do things like that. You decide what works for you. You can use technology to connect you in beautiful, wonderful ways, being sexual together. You could, think about it. There's so many fun, exciting things you could do between maybe a FaceTime kind of thing or a phone call kind of thing. I think it's a great thing.
Absolutely. So don't forget the importance of date night. You don't have to be undressed for everything to get these good hormones going. You could have date night on the phone, or you could have date night in person, but maybe that your sex will be your sexual exchange. It'll be talking about how much fun we're going to have when we're together next. But that anticipation is very exciting, and that releases dopamine as well. Then things that, if date night doesn't happen, what about a week away or a weekend away? Again, research suggests that women really need at least an overnight away, or away from the kids, or away from the world. And that might mean the in-laws are taking the kids, or your best friends, or, you watch their kids and they watch your kids, but something like that. So about every 2 months, about one night of dedicated time with the partner that extends past dinner, but through the whole night. So about every 2 months for that. About every 2 weeks for date night or connection time, and that could be FaceTime, and then every 2 months for a night away if possible. And it doesn't have to be terribly expensive. I got some great creative patients who do things like, again, with the neighbors, they watch the neighbor's kid one Saturday night every 2 months, and then the neighbors watch their kids one night every 2 months. And so that gives them special time. They don't have to go out to an expensive restaurant. They stay home, they watch Netflix, then they go to bed and cuddle. It's just a beautiful thing. But you can watch that explosion of neurotransmitters after that special night.
And even things like, you think, oh, wow, oh, God, you're living through construction in your house. Well,
Yeah.
you could throw, and you're thinking, oh, this is such a disaster. Think creatively. Throw one of those tarps on the bed, get out the dessert sauces, make a bad thing a good thing, It's like, try to think out of the box a little, because those novel things increase dopamine as well, right? So
Absolutely.
it's pretty exciting. So I put this on because you were kind of getting into all these things that cultivate afterglow, which are such good suggestions for sure. But I think the biggest thing, honestly, is slow down. Stop for a moment, breathe into this moment with your partner,
Yeah, absolutely. I think we all go way too fast and way too hard. That's kind of an American thing. I will tell you that the Europeans kind of savor a little bit more than we do. They savor their wine, they savor their dinner, and they savor their downtime quite a bit. But
they're present. They're present. That's the biggest thing. Show up.
Yeah.
The greatest gift you can give your partner is to be fully present and engaged with them, locked in. And remember, when you do this, it's going to lock you in even more. So it's pretty exciting. So I think showing up and being present is just a great gift we give each other. So I think that's really cool. I want to hear more of the different things you have to cultivate. I love all these ideas.
So we talked about the rule of 2 for women. It's every 2 weeks, a date night, every 2 months, a dedicated overnight of some sort. And then every 2 years, I don't think that's asking too much, a full weekend away, or if you're really lucky, a full week away with each other. And I know for a fact, I think you know for a fact, that both Jeff and I have been married over 40 years. And this is one thing that we hold sacred to keep these marriages going on. Because no matter how good looking your partner is, 40 years is a long time. And so, so to keep it going on, we do weeks away as we get a little bit older. In my younger days, it was a weekend away. It was like the most amazing thing. A whole weekend with my partner every 2 years was all I could frankly afford, both in time, but in money sometimes. But don't forget, those things are important. I can't tell you how many times I see a patient who's seen, we haven't been together alone on any kind of getaway for, they say 10 years, 12 years, 14 years, 20 years. That's not paying the right amount of attention. And again, you can go camping. You can put a tent in a campground for very little money, very, very little money. And still
put a tent in your backyard if you can't afford to go to a campground.
Exactly. But it's time that you can spend away and really dedicate it. And you know what? We give people in our environment all that time when they need it. We attend to loved ones as they're getting older. We tend to babies when they're young. We give them all of our time, and that is what they should have. But our partners and ourselves deserve time dedicated for each other. So don't forget the rule of 2. Every 2 weeks, date night. Every 2 months, an overnight. And every 2 years, a weekend or a week away just with your partner. Just think about it. Helps those neurotransmitters keep rolling. Because in fairness, you can't have sex every night. I mean, I guess you could, but you don't usually. And so you got to do things that cultivate those neurotransmitters.
Yes. Okay. And if you're wondering, oh my gosh, are we normal? Well, you look at the average American between age 18 and 59, not necessarily the older people like myself, but when you look at them, what they discovered in the research was people have sex 1 to 2 times a week is the average across the United States for that age group. So, if that's what you're doing, great. If you're doing more, that's great too. If you're doing less, is it working for you? That's what matters. But what I was thinking about when you were saying that, because I know we've really cultivated our marriages over the years with my wife and with your husband, Kurt, as well. And part of it was you got to be creative. I had to travel. Part of what I do is traveling. And so we would work in those getaways where Julie would come along with me. Right. Our families were thrilled. They got the kids to themselves, and we got to get away together back when the kids were little. Nowadays, again, I already look ahead at the trips. Julie always checks my trips that I have to go on to do speaking. And she's like, okay, I'm going here. We're going to go do this. I'm going to go. And that's great, because truly it can be expensive. It can be challenging, but there's ways to work it out that it doesn't have to be. And even like in the Chicago area over by where Vic, the producer, is, in Indiana, they have some really economical cottages or campgrounds or places that you could go and have some time away. And then go in off season. Those cottages that are so expensive in the summer over there, in the winter, you're going to be in the room anyway. How fun. You can just hold up in that room and have a wonderful time. And it can be a lot less expensive, because I realize this is not always easy to do. But I think if you I don't know about you, Susan, but this is what I'd say after 40 plus years of marriage, and we've both been married almost the exact same amount of time.
Yep.
What is a better investment than yourself, investing in self-care and investing in your loving relationship? What could be a more important investment than those 2 things?
I agree completely. And, if they look at the amount of resources that are put toward, for people to really look hard and deep in their own life, look at resources for Starbucks coffee, look at resources dedicated to door dashing, things like that, and try to redirect those maybe just for 1 month, redirect them. That's one night in a hotel or one night in a campground.
Totally. People always laugh. They're like, you have the best lunches. I'm like, leftovers. I never buy lunch. I always bring lunch and breakfast to work, because just lunch and breakfast, if you bought those out, I mean, you could spend a good $20 to $30 easy, and that's just getting light things. So, but if you collect that money, and if you did that 5 days a week, think about how much money you'd have to go do these things. How can you put your money into the things that really matter? If you don't intentionally put these things into your life, they're not going to happen. So all these things are important. And that affectionate touch afterwards and before, all of it all causes these hormones and neurotransmitters to increase, and it is a synergistic effect. Expressing gratitude. I did a whole podcast on the power of gratitude. It's such a big deal. I'm so grateful for, I think, my gosh, 40 plus years with I still can't wait to see my wife. Yes, do we drive each other insane sometimes? Absolutely. But I still love spending time with her and enjoy being with her. And I'm so grateful for her. When was the last time you said that necessarily? Or specifically, if you make it specific, it's even more meaningful. Wow. That meal you just made was amazing. And I know you put a lot of time and effort into it. I am just so grateful that you fed my, not just my body, but my soul with that amazing, amazing meal, or whatever it is,
And for people who aren't married to a great cook, you're like thankful for little things. Like, I know you don't love taking the garbage out, but thanks again for doing it. Just a thanks again, because we don't always desire the roles we play in a relationship. We don't desire everything. I don't desire like vacuuming or whatever, but I really do appreciate a thank you. And I really appreciate giving a thank you for the little things that happen every day to make our house run. And so don't forget, you can text too. You don't always have to be like talking. A quick text in the middle of the day means a lot, especially when you're at work and you look at it and you're thinking, are you serious? I just got a thank you text from my partner. That's pretty cool. So
thank you for putting the seat down in the middle of the night so I don't fall in the toilet when I go in there in the dark in our shared bathroom. There's so many things to be grateful for. And every day, every moment, you have another chance to get it right and do it even better and be your best self and show up in that relationship. So the list here just talks about how important all those things are. Skin to skin contact, the affirmations, don't rush away. We talked about that already, creating emotional safety. And you had talked about earlier too, about it not having to necessarily be about penetration either, which is really important too. But these are some of the things that cultivate Afterglow. But here's the things that kind of interfere with it. And God knows we all got plenty of this: chronic stress, unresolved resentment, those issues that they just keep building up and you never really hammer out or talk about with your partner. That is going to create emotional space between you. And some people can't really struggle with being intimate with their partner when they are feeling this unresolved resentment. Everybody has shame. Everybody, I love Brene Brown's work around shame, but we all have different things that we feel really self-conscious about or dealing with. Past traumas come into play and affect Afterglow. That's why sometimes people jump out of bed because it's like, oh my God, I don't want them to see me anymore naked. I got to put clothes on, or I got to get in the shower because I feel dirty. And some of that can be from past experiences, especially traumatic experiences. And then, of course, we've done talks on pain during sex, being distracted, or you're doing your grocery list while you're in your mind while
in
you're
the middle of it. Not a good idea.
Turn off your phone. We did a whole episode on turn off your phone, turn on your love life. It's like, yes. And then rushing back to work. Work will always be there, but your partner. How much does your work matter compared to when you're gone? Who's going to be devastated? Your partner, not necessarily the people from your job. They will find someone to do the job. Trust me, every job, my job included. And so untreated sexual dysfunction, just a list of things that may be hindering Afterglow as we're thinking about it.
Can I talk about one more thing that I hear every single day? And I just really want to bring this up.
Yes.
Sometimes the expectations of a partner that you will have like a 10 out of 10 experience every time. Now, let's be real. When you're sexually active with the same person over and over, it's not going to be 10 out of 10 every time. It's just not. There's times you're not feeling 100%. There's times that you're just plain not, N-O-T, not going to climax. And that is not a deal killer for women at all. Not at all. Not even remotely. And so after a beautiful interlude, if a partner says, particularly, you can talk about the man's perspective, please, but from a woman's perspective, when a partner's like, but you didn't come, I know you didn't, I would just know, and so it was a worthless experience, it was just terrible. Well, guess what? It wasn't worthless until that comment came out. It can be a wonderful, beautiful, close, loving experience, complete with release of dopamine, oxytocin, prolactin, and endorphins without a full mind-blowing orgasm for women. It can. And that buzz is killed if the partner says, but you didn't, why didn't you? Let's keep going until you. Not necessary. Please, please, please know that if a woman says she's satisfied, no matter the situation in which she became satisfied, please believe her because she is.
Yes.
How about for men? Talk to me.
Gosh, I'm so glad you brought this up because I just was explaining this to one of my patients because he's like, I know, she keeps telling me that it's okay. She keeps telling me that it's all right, but I know it's not. There's no way it could be okay. And I said to him, stop, listen to me. You have 10 times more testosterone than she does before she went through menopause. Mm-hmm. You have no idea how she feels. And when she tells you something, believe her. Yeah. I think it's really, really important. But I think as men, we think we can't imagine it. No, you can't imagine it. Because if you had half as much testosterone, we'd be like, trust me, because we're used to walking around with 10 times more testosterone. So you cannot imagine it. So stop trying to and listen to, trust, and believe what your partner's telling you. And that goes for any partners, whether it's woman and woman or a man and man or a man and woman, whatever, or a trans with or a non-binary person, whoever and whatever you are. Trust is one of the foundations of your relationship and believing them. Suze, I've had people in my office, literally, she's like, I swear I'm telling you the truth. I'm not, you think I'm being nice, but I'm not that nice. And he's like, right. No, I think you're just trying to make me feel better. And I'm like, guys, come on, come on. So yeah. I love that you brought that point up because it is a really big deal. And I think for some men too, here's the thing. I didn't climax this time. Maybe that's purposeful because I'm going to really look forward to next time because this time I wanted it to be about you. And that's okay. It doesn't always have to be reciprocal. It doesn't.
Absolutely. Because sometimes if you're not so busy climaxing, you can, I'm going to be very blunt here, you can hold on tight and experience the other person's climax as if it were your, I mean, it's wild. It's so fun to experience the other person's climax with them when you're not so busy being distracted on your own. And so it can be a really cool thing. And I just want to please listen when we tell you this from both men and women's perspective. Please know that when your partner says that was awesome, believe them, no matter what the circumstances were, believe them.
And what you said earlier, I'd like to refer our listeners back to the good enough sex model. It may not always be an explosion and a whatever, but did you feel connected? Did you have fun? And was it pleasurable? That's awesome. With your pain, with the different things your life is that are happening to you in life right now, it may not be possible to be a 4th of July moment, but did you feel connected? Did you have pleasure? You succeeded. What a beautiful moment that you just had. And oh my gosh, Suze, don't let either of you, whoever you are out there, or many of you, don't let it ruin it by going, ugh, or getting upset because you lost an erection. Go to plan B. You got a tongue, you got fingers, you have all kinds of ways to satisfy your partner. And plan B can be a really fun detour. So It's a mindset and it's a programming that's been done by our society that makes us believe, again, that shame, I'm not enough. If I didn't give you a climax, or I don't have an erection, or my back hurts and I have to move in a different position.
Yeah. Or even stop. Yeah. Yeah.
Stop, or I have to stop. It's still you're still enough. You're still enough. And it doesn't define you. So those are really important things. So yeah, good stuff, definitely. We talked about cultivating. Oh, these are just for our listeners out there. This is based in science, I promise you.
Mhm.
And these are some of the references, just a few. There's so many great things out there, but those are just a few of the different ones that show you. But gosh, Afterglow is such an amazing thing. But we just brought up some really good points. And I think we can take down the slides now, Vic, and we're just going to chat because we have a little more to say. Isn't it amazing though? And I'm sure people out there are thinking, wow, I thought it was just me but you're not alone. As we get older, we can't get in the positions we could get in, but we can still have amazing connectivity and intimacy, connection on all levels. And why don't sometimes let's take orgasms off the table. What do you think about that, Suze? Let's take them off the table and just everything but, or whatever, take intercourse off the table, or take genitals off the table.
Mm-hmm. It's amazing how creative you have to be when you keep your underwear on. I mean, it's amazing. It can be really fun. You can feel kind of young. It's like 16, or 12, or however old you were.
Right, and don't get arrested, but what about the car? You used to think about what you used to do in a car and with clothes on, because you weren't allowed to take your clothes off, right? Sometimes.
Exactly. So, I think the one last thing I would like to just bring up is that we tend to talk a lot in this podcast about couple play, and no matter what gender, or we could talk about polyamory, but what we didn't always talk about is solo sex. And that is, you can still have that explosion of neurochemicals when you are stimulating yourself. And for many people, that is how they self-comfort. It's how they get to sleep at night. It's because they know that those chemicals make them feel so contented and so relaxed, and off to sleep they go. And that is an absolute beautiful way to experience the chemicals on your own. And so these rules still apply when you're not interacting with another person directly. Really important to remember that.
I'm so glad you brought that up. And actually, we are going to have an amazing episode in October on the exploring and navigating your own body. And so we're going to focus more on that, because we forget that a lot. So thank you for bringing that up, because that's a really important topic too.
Sure.
I am going to do a little bit of a closing centering exercise. We're going to get a peek at next week, and then we'll come back for a final message from both of us in just a minute. So as we always do at this point, I would like to, before we close the episode, I'd like to invite you just for a moment to reflect. If you're able, place both feet on the floor, or simply settle comfortably where you are right now. Take a slow, deep breath in your nose and gently exhale. Again, breathe in. Allow your shoulders to soften, and breathe out, letting go of any tension you're carrying in your body. As you continue breathing, fall into a more natural pattern and bring to mind someone with whom you share a meaningful relationship. Someone you share a meaningful relationship. Notice not only the big moments that you've shared, but the small ones. Maybe a warm embrace. Maybe holding hands. A lingering kiss or on the back of the neck. A genuine laugh together. A deep laugh from your belly. A quiet conversation before falling asleep. Remember that intimacy isn't measured by frequency or perfection. It's built through moments of patience, presence, showing up, kindness, affection, and genuine connection. When you show up, you can genuinely connect. It's a beautiful, beautiful feeling. Those moments leave an imprint. They create trust. They build emotional safety. They remind us that we are seen, that we're valued, and that we're loved. That afterglow is a beautiful thing. As you breathe silently, repeat after me. I choose presence over perfection. I choose presence over perfection. I give and receive affection with openness. I give and receive affection with openness. Small moments of connection create lasting love. Small moments of connection create lasting love. I am worthy of intimacy, joy, and authentic connection. I am worthy of intimacy, joy, and authentic connection. Take a final breath in and exhale. As you move through the coming days, consider one small way you can intentionally create an afterglow in your relationship, not simply through sexual intimacy, but through affection, through gratitude, laughter, kindness, or a few uninterrupted moments of genuine presence. Sometimes the smallest acts of love have the longest lasting effects. Well, Vic, can you give us a glimpse at what we are going to be talking about next week on Dr. Jeff Talks About Sex and Intimacy?
Sexual health isn't just about what we feel. It's also about what we do and why we do it. In this episode, Sexual Behavior Analysis, a new frontier in sexology, Dr. Jeff is joined by Nicholas Mayo-Ather to explore an emerging and innovative approach to understanding sexual behavior through the lens of behavioral science. Sexual behavior analysis applies principles of behavior, reinforcement, conditioning, and learned patterns to help individuals and couples better understand their sexual experiences. Join us on July 21st at 7 p.m. Central Time to learn more.
Wow, Vic, you even got my beard in that promo video. I'm impressed. He always tries to catch me off guard and make me laugh with those ticklers. But it's going to be a great episode. I'm really looking forward to Nicholas Mayo coming on the show and talking about that. But this week, Afterglow. Gosh, so much to unpack, so many things we could talk about. What final words do you have for listeners as we close out?
Well, for just like anything we talk about on this show, there are people who don't always relate to it. They'll say, you're not going to believe this, but sometimes after I'm intimate with a partner, I feel anxiety, I feel teary, I feel irritated, and I'm not sure what's going on. So stay tuned, because Jeff and I will be talking about the opposite of afterglow, called postcoital dysphoria, in October. For people who maybe can't relate to what we talked about, there is a flip side of this coin. It is not as common, but clearly we can talk about it, and we can talk about what you can do about it as well. But for the rest of you that experience what we did talk about, please remember that you don't have to have sex every 48 hours, but to remember that a little goes a long way. And it's such a goodwill producer for people who do experience afterglow. Don't forget the power of afterglow.
For sure. Wow. I love that. Afterglow reminds us that intimacy isn't about what happens in the bedroom. It's about what happens in the relationship afterward. A loving touch, a lingering embrace, a heartfelt conversation, or simply staying close for a few minutes can echo into tomorrow, maybe even the next day. That's afterglow. Those moments become the emotional glue that helps couples to navigate everyday life. Some of the hardest thing is just the everyday living, the moment to moment, the hour to hour stuff that becomes difficult. But it gives us a little more patience, a little more kindness, a little more connection. I know I need all those things. I don't know about you, Dr. Suze, but I need them for sure.
Sure do. Absolutely.
thank you so much for joining me. I love having you on, and I really love the idea of that episode we will do in October to give you other ideas about when afterwards you aren't feeling so good or you're upset. I think that's a great topic. Always good having you here. And listener, you're why we're here. There's only one reason. We certainly don't get paid to be here. We are here because we care about you, and this is a labor of love for us. And so thank you for spending the time with us and learning more about this, and join us again next time. Thanks.
As Dr. Jeff talks about sex